As her shift ended, Nurse Ashley Johnson was cycling home along the Santa Monica coastline, enjoying the beautiful summer day. Suddenly, she heard a sharp scream and turned to see a man struggling beneath the waves. While beachgoers panicked and shouted, Ashley dropped her bike and ran into the water. "Stop! Too dangerous!" yelled an elderly man. "Nobody can swim in this current." But Ashley was already powering through the waves with strong strokes, because waters like these were far from foreign to her. And in the next 25 minutes, everyone on that beach would learn who Ashley Johnson really was. Because some nurses don't just save lives in hospital corridors, they know how to save them in the deepest parts of the ocean. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Ashley Johnson was the most reliable nurse at Cedars-Sinai Medical Center. At 32, she'd been working at the same hospital for 3 years. She never missed night shifts, maintained flawless patient care reports, and never complained despite challenging situations. Everyone in the cardiology department felt secure in Ashley's presence. She remained composed even in the most stressful moments, resolved complex situations, and always had necessary supplies ready. With her light brown hair pulled back in a practical ponytail, Ashley brought comfort to patients through her gentle touch and calmed them with her peaceful voice. Her blue nurse scrubs were always clean, her stethoscope organized in her neck bag, her identity clear but humble. Ashley's level of medical intervention went far beyond standard nursing education. During emergencies, while others applied basic life support, she could demonstrate much more advanced analytical approaches. "How do you examine so thoroughly?" they would wonder. "You learn through experience," Ashley would say briefly. But this experience hadn't come from ordinary sources at all. Ashley's equipment organization distinctly differed from her colleagues. She would arrange each supply with military precision, checking emergency response tools, monitors, and IV systems as if preparing for a critical operation. Sometimes her colleagues found this perfectionism excessive. "We're just nurses, Ashley, not special forces," they would joke. Ashley would smile without explaining, knowing that both sides were actually wrong. Ashley's emergency leadership abilities amazed even doctors. "Where did you acquire this command capability?" they would question. "Experience," Ashley would say, always vague, never going into details. And these experiences were gained in completely different fields from normal nursing education. Ashley Johnson had joined the Navy at 18. When she joined the Navy, she chose the Navy Rescue Swimmer Program. After basic naval training, she was accepted into special programs, Naval Special Warfare, the world's most challenging underwater rescue program. But this was just the beginning. The real specialized training was yet to come. Combat Rescue Swimmer School, 12 months of intensive underwater training. Storm sea rescues, operations in limited visibility, deep water search and rescue. Ashley was selected for the top 5%, and this training would save lives that day at Santa Monica. "A rescue swimmer isn't just a swimmer," said Training Commander Chief Petty Officer Davis. "You're the person making life and death decisions underwater. No matter how big the waves, no matter how strong the current, you will save the missing persons." Ashley embraced this philosophy, conducting extreme weather water rescue operations, performing dives in zero visibility, providing rescue team leadership in critical moments, and fighting rescue battles despite technical difficulties became her core values. The hardest part of her training was deep water emergency rescue operations. Storm ocean search and rescue, underwater operations with basic equipment, improvised rescue techniques. Ashley developed exceptional abilities in this area. Her first assignment was in the North Atlantic on sea rescue operations. Cold waters, high waves, life-saving missions from lost ships. Ashley's most challenging intervention was rescuing 4 people from a fishing boat that sank during a snowstorm. In icy waters with zero visibility, using only sound navigation, she had pulled the entire crew from the water. Her second assignment was in the Pacific, providing special operations support. rescuing downed aircraft pilots in enemy waters, underwater search missions in hostile environments, covert rescue operations. The techniques she learned in these missions were methods never used in civilian life, especially missing person location methods in extreme water conditions. Ashley had taught herself to work in environments where visibility was zero, minimal light, limited breath, maximum efficiency. Her hands had become underwater navigation tools, and these abilities would be critical that day on the beach. Her third assignment was Gulf region naval-based security rescues, oil platform emergencies, submarine accident rescues, high-risk underwater operations. Ashley now had rescue specialist-level expertise in all types of marine conditions. But most importantly, she never allowed any weather condition to stop a rescue operation. Over 11 years, Ashley had successfully completed 156 critical water rescue operations, never abandoning any due to weather conditions. So why had she left the Navy to become a nurse? This story was more complex. PTSD, adjustment issues, civilian life challenges. Ashley's transition hadn't been easy. High-stress rescue work felt comfortable, but civilian hierarchy was different, and this tension would explode that day. After receiving an honorable discharge in 2022, Ashley had transitioned to the civilian health field. She used PTSD therapy, adjustment counseling, and career transition support. Nursing had been a perfect choice. It reminded her why she became a rescue swimmer, helping people at risk. The hospital environment was a predictable routine after years of uncertainty. Peace was welcome. When Cedars-Sinai Medical Center hired her, Ashley was overqualified. Nursing license, 11 years of military rescue experience, Naval Special Warfare certifications. But the hiring panel didn't ask detailed questions. They were happy to find a qualified nurse. "I've always loved helping heal people," Ashley had said, and this time she was completely sincere. Daily duties were simple compared to combat rescue operations, patient care, medical support, routine procedures. But Ashley was doing much more. She analyzed every case with rescue swimmer eyes. She anticipated potential emergencies in advance. She predicted how critical cases might develop. "Ashley, how do you make patient assessments so detailed?" her colleague Maria would say. "Observation," Ashley would reply. "Every patient teaches something." This observation came from 11 years of combat rescue operations training. That beautiful summer afternoon as her shift ended, Ashley left Cedars-Sinai. She planned to cycle home along the Santa Monica coastline. She'd changed out of her blue nurse scrubs into athletic wear, a breathable white tank top and dark green shorts. Her light brown hair gleamed in the sun. While cycling along Pacific Coast Highway, Ashley kept the ocean in view. The waves looked stronger than normal, the currents appeared fast. Naval Special Warfare training had given her automatic water condition assessment ability. Around 4:30 p.m., passing through the popular beach area near Santa Monica Pier, Ashley saw a peaceful scene. About 50 people were on the beach, families, young people, retirees. Normal summer afternoon atmosphere. As she was slowing her bike, she heard a sharp scream. She turned toward the sound, and the scene she saw froze her blood. About 100 meters offshore, a man was struggling in the water. He was raising and lowering his arms, trying to keep his head above water, but waves kept pulling him under. The strong current was carrying him away from shore. The beachgoers were in panic mode. They were shouting, making phone calls, calling to each other, "Someone help him!" But nobody was entering the water. "I called 911, shouted a young woman. "Lifeguards will take 10 minutes. Ashley assessed the current and distance. The man was being swept offshore every second. 10 minutes was too long. In 3 to 4 minutes, he would likely be lost at sea. Ashley threw her bike down and started removing her athletic shoes. "No, ma'am," shouted an elderly man. "Stop! Too dangerous! Nobody can swim in this current. You'll drown too." But Ashley was already running toward the beach because waters like these, currents like these, rescue scenarios like these were far from foreign to her. When Ashley dove into the water, her body automatically switched to Naval Special Warfare mode. This wasn't just a nurse's reflex. It was the automatic activation of 11 years of combat rescue operations experience. The water was cold, but Ashley's body was accustomed to thermal regulation. In her first strokes, she oriented herself to the water. The current was strong but predictable. Waves were 4 to 5 feet high. She would need to account for rip current effect. A rescue strategy formed in her mind. Diagonal approach, triangular approach accounting for current, assess victim's panic level, minimize hypothermia risk. She needed to swim 150 meters. For Ashley, this was routine distance. In naval special warfare, she had done 500-meter fully equipped swims, combat rescue operations under war conditions. As the distance to the victim decreased, Ashley evaluated him. Male in his 40s, athletic build but exhausted, panicked but not yet at the water ingestion stage. High rescue probability. When 50 meters remained, the man noticed Ashley and started trying to swim toward her. This was a critical mistake. "Don't move," Ashley shouted with her powerful voice. "I'm coming to you. Stay calm." But the man wasn't in panic. He was reaching the exhaustion stage. His arms could no longer support him. His breathing rhythm was breaking down. Ashley took rescue position, supporting the man's chin with her left arm while swimming powerfully toward shore with her right arm. The current was trying to pull them offshore, but Ashley's naval special warfare training was prepared for this situation. Using diagonal swimming technique, she executed effective swimming against the current. She covered the 75-meter distance in 4 minutes, bringing the man to safe, shallow water. But just as they reached shore, the man completely lost consciousness. His pulse weakened, breathing stopped. Ashley quickly pulled him onto the beach. Ashley positioned the man safely on the sand and immediately began CPR. The crowd on the beach approached in amazement. "What's that woman doing? CPR? She looks professional." But for Ashley, this was routine operational procedure. In naval special warfare, shore rescue operations, emergency medical intervention, critical life support, all of these were training curriculum. When Ashley began CPR, her body automatically switched to naval special warfare mode. 30 compressions, 2 breaths, military standard protocol. She counted each compression, monitored pulse, assessed consciousness level. At the 5-minute mark, the man began breathing slightly but was still unconscious. Ashley continued CPR uninterrupted. Her arms were starting to tire, but 11 years of training had programmed her never to give up. The beachgoers watched as if mesmerized. Nobody believed someone could perform such effective CPR for so long. Who is this woman? Is she a doctor? How does she know this technique? At the 8-minute mark, the man's pulse began strengthening. Ashley's naval special warfare training was working. The critical rescue operation was heading toward success. "Come back," Ashley murmured while maintaining continuous compression. "I promised Emma, nobody gets lost in the water." At the 12-minute mark, the man began coughing. Water was coming out, breathing was improving. Ashley reduced compressions and switched to vital monitoring. At the 15-minute mark, the man's eyes slowly opened. What happened?" he murmured, breathing with difficulty. "You're safe," Ashley said in her calm but authoritative voice. "You had a near drowning. I performed 18 minutes of CPR. You need to go to the hospital now." At the 18-minute mark, Ashley had completed the CPR. Everyone on the beach was applauding, but for Ashley, the operation wasn't finished yet. Hypothermia, water aspiration complications, and respiratory monitoring were still needed. Ashley positioned the man in recovery position and began comprehensive assessment, vital signs monitoring, hypothermia evaluation, respiratory function check. This wasn't basic first aid. It was combat medicine under field conditions. "Call an ambulance," she shouted to someone on the beach. "I'm a nurse," Ashley said. "This man is stable. Hypothermia risk exists, but not critical." The beachgoers turned their attention to Ashley. Who was this woman? How had she performed 18 minutes of CPR? How was she so calm? The EMS team arrived 12 minutes later. Paramedic Tim Chen began scene assessment. "What's the situation?" "Male patient, estimated age 45, near drowning case," Ashley said in professional reporting voice. "Underwater approximately 3 minutes, 18 minutes shore-based CPR administered. Current status, spontaneous breathing present, strong pulse, early stage hypothermia. Tim Chen looked at Ashley in amazement. This was professional-level reporting, not typical civilian intervention. "Ma'am, what's your medical background?" Tim asked while continuing the victim's care. Ashley hesitated. "Registered nurse," she replied, helping transfer the man to the stretcher. "Your assessment is extremely thorough. Do you have specialized training?" Ashley paused. "Military medicine." "Which branch?" "Navy, combat rescue specialist." The lead paramedic looked at Ashley with new respect. "How long?" 11 years, 3 deployment periods, combat rescue operations specialist." Tim nodded. "That explains everything. Your patient care was textbook perfect." The rescued man was transported to the hospital and made a full recovery. Ashley's 18 minutes of CPR on the beach had saved his life. The witnesses on the beach continued talking about the incident. That woman was like an angel. How did she know to perform CPR for so long? She was so professional. Local news heard about Ashley's story. Hidden hero. Hospital nurse turns out to be naval rescue specialist. But Ashley gave no interview, didn't appear on cameras. The next day she came to work as usual. Same blue scrubs, same ID card, same route. But nothing was the same anymore. Her colleagues looked at her with different eyes. They addressed her respectfully as Nurse Johnson, rather than just Ashley. Cardiology department head nurse Patricia Williams called Ashley to her office. "Ashley," she said, "can I understand what happened yesterday?" "I saw it on TV." Ashley was hesitant. She'd been avoiding this conversation for 3 years. "I have medical training," she said simply. "Medical training?" Williams looked amazed. "Ashley, you performed 18 minutes of CPR on the beach. That's not possible with normal medical education." Ashley took a deep breath and realized it was time to tell the truth. "I was a Navy Special Warfare Combat Rescue Specialist, 11 years active duty." Williams froze. You were a Navy SEAL?" "No," Ashley corrected. "Navy rescue swimmer. Special Operations Naval Rescue Specialist." Williams stared in disbelief. "Why did you never mention this?" "It wasn't necessary. I'm a nurse now." Ashley's story spread through the hospital community. The nurse, who's actually a combat rescue specialist. Stories were told throughout the medical community, and these stories began inspiring other military veterans. Young nurses wanted to learn from Ashley. How do you stay so calm during the most stressful situations? Experience, training, understanding that every patient matters equally. Ashley started a mentorship program, military to civilian healthcare transition support, so other veterans could find similar paths. A specialized emergency rescue unit was established at Cedars-Sinai. Ashley became the lead instructor. Military rescue experience was being transferred to civilian healthcare. A year later, Ashley became emergency response coordinator, but she never left her nursing identity behind. "Field rescue teaches you differently," Ashley would say. "Every second counts. Every decision is vital. Every patient deserves to be saved." Maria and Jake began working on Ashley's emergency team. A pipeline from nursing to rescue specialist had been created. Ashley's story isn't just about heroism, it's also about rescue expertise, finding meaning in civilian life, the instinct to serve and never giving up. Because sometimes the greatest rescuers work as nurses in hospitals, ready to save lives even in the ocean. When the people Ashley saved see her, they say, "Real heroes overcome currents." The courage Ashley showed that day at Santa Monica didn't just come from naval training. It came from her determination to protect people from extreme situations in civilian life. "I'm no longer a soldier," Ashley says. "I'm a healer, and no current will cause me to lose people." Ashley Johnson's story is real. She's still there in hospital corridors, continuing to save lives. Maybe there are similar hidden heroes around you too. Maybe your nurse, your doctor, or your healthcare worker has also lived a very different life in the past. Show them respect, because they deserve much more than what's apparent. Here at Hidden Legends, we continue telling the stories of these kinds of hidden heroes. Tell us in the comments which city you're watching this video from. And have you ever encountered a healthcare worker with such a hidden background? If Ashley's story moved you, like the video and subscribe to the Hidden Legends channel. Turn on notifications because we share the unknown stories of real heroes every single day. And remember, your healthcare provider might also be someone like Ashley Johnson. See them, respect them. Until we meet in the next Hidden Legends video, keep your eyes open for the extraordinary hidden in ordinary people.